So hormone therapy is very important. I give testosterone in several forms. I have my favorites. There are creams, there are gels, there are injections, there are patches, there are pellets. If I use creams, I don't get as good of an effect because the cream, when the testosterone crosses the skin, it changes to dihydrotestosterone. There's an enzyme that lives in the skin and the hair follicle that changes testosterone to dihydrotestosterone, and DHT, dihydrotestosterone, does not cross the blood-brain barrier. That's why I don't see quite an effect with the creams. Injections work nice, but you have fluctuating testosterone, ebbing and flowing. Pellet therapy is my favorite, simply because when I put a pellet in the sub-Q fat, it's surrounded by a capillary bed, which is connected to your heart rate, so you actually do get a pretty good circadian rhythm, pulling off the hormone as your body actually needs it. So if you're struggling from ED, low libido, as a result of your low T, RMI offers other options as well. The first we offer is called the P-shot, the Priapus shot. And basically that's taking your blood, spinning out the growth factors out of the blood, and putting them into the penis under a local anesthetic. It's very low pain, pretty much pain-free, and those growth factors help stimulate regenerative tissue within the penis, increasing the function of your ability to get an erection, maintain an erection, and also give you endurance. I also use the Hydromax Pump. That is a water pump that I really like. I use it in my practice. It stretches tissue. It helps increase blood flow into the penis. And I have my men who actually get a P-shot do that every day. Acoustic pressure wave therapy. I like this a lot. This is called pulse wave or shock wave. And what it does, it puts acoustic pressure waves into the penile shaft, which increases blood flow. It reduces kind of scar tissue, and it helps really increase regenerative tissue within the penile shaft. I use Cell Matrix MD, which is a topical application of a gel. It's basically made of many botanicals, which increase blood flow and the function of both the penis in the male, as well as vaginal health in the female. And then I also use peptide treatments. There are a variety of peptide treatments that I use. Peptides are short amino acid chains. They're very safe. We have lots of peptides in our body, and there are certain peptides that can really help you with your sexual health. Bioidentical hormone therapy is another option, which I offer in my practice at Body Logic MD of Greenville. This process may include pellet therapy, like I talked about earlier. This is a great solution for many patients. Each pellet contains a customized blend of hormones, and it's delivered as a steady dose of testosterone, mimicking your body's natural response that I talked about. Lastly, there are some lifestyle changes that you can make to help keep your hormones balanced. These include the following. Please eat a healthy diet. Stay away from the processed foods. Stay away from the omega-6 fatty acids, saturated fatty acids, high sugar foods. Eat lean and clean. I tell my patients, please eat lean and clean. That means clean protein, lean types of meats, reduced fat, lots of good vegetables and antioxidants. Regular exercise is very important. It helps build muscle mass, it helps increase blood flow, it helps brain activity. So regular exercise releases certain endorphins that certainly help the body and also help balance your hormones. Plenty of sleep is very, very important. If there's one thing in my age management practice that I help my patients try to achieve is adequate amount of sleep. Sleep is when the body goes through restorative properties. Regenerative medicine occurs during sleep. Testosterone production mainly occurs during REM, so getting adequate sleep really, really can help you tremendously.